Hi, I'm Dr. Vidhu Anand, Cardiology Fellow at Mayo Clinic Rochester here at ACC 2018, and with me is Dr. Zoghbi, Cardiology Chair at Methodist, Houston. Thank you so much for joining us today, Dr. Zoghbi.
Great to be with you. Looking forward to it.
Thank you. Can you tell us about your research here at ACC 2018?
Well, our area of research, my personal area of research, is quite a bit in valvular heart disease. So we're presenting something on mitral regurgitation, atrial mitral regurgitation. Also, we're looking at modeling the mitral valve into mitral valve strain and see what the outcome would look like. So this is a new area of research that I'm really very excited about, certainly involving our fellows in it.
Sounds very exciting. So with the advances in multimodality imaging, where do you see this field going, and how often do you use multimodality imaging in assessing patients with valvular heart disease?
I think multimodality is the way to go, and down the line I think you will drop the name multimodality and think about imaging per se. I think we're fortunate to have all the imaging, the advanced imaging modalities nowadays of MRI, CT, echo and nuclear, the traditional ones. In valvular heart disease, I think this is crucial. We used to depend only on echocardiography, be it echo transthoracic or transesophageal. We know now there are some limitations to this, although this is still the major workhorse. And in certain areas, we need particularly cardiac MRI to look at quantitation, particularly in valve regurgitation and valve stenosis. But also CT is very important, as you know very well, in planning TAVR procedures and even total mitral valve repair procedures. So an integrated look as to starting with echocardiography and seeing where else do you need multimodality to try to refine your assessment of regurgitation or stenosis.
And how often do you use these other multimodality techniques for when you're assessing patients with valvular heart disease?
I think, I'm guessing, I don't have the data actually per se, but in TAVR nowadays, is any patient who's already planning to go for TAVR procedure, you will see CT most of the time. I think this is an integral part. In mitral regurgitation, we usually use it for the difficult cases of echocardiography, and these are usually in very eccentric jets that you cannot quantitate as well. The traditional ways of using PISA or the others may not be as good. I'm guessing in about 10% of the patients or so that you would need further imaging to try to refine it further.
And what advice do you have for fellows in training who are interested in academic career and research, and how to pick a research mentor?
We would encourage our fellows. Actually, in our training program, fellows are almost mandated to have a research project during their training. I think it's very important. And the reason for it is not necessarily to go into the research field, but to understand also what goes on behind the research, learn from their research experience how to read papers, how to read the literature critically. And we hope that about maybe 30% of the graduates would go into academic medicine so they can be the teachers themselves down the line. I think research, people ask me always, well, what kind of project should I pick, or how the mentor is? Number one, if you're wondering whether there is still research to be done, just look at the appropriate criteria, appropriate utilization criteria. There's always an undeterminate area of whether a technique should be used on a particular patient. This could be at least one source of that. The other thing is, in your institution, you have to pick a mentor, and a mentor that one cares about what you do, productive in research, but most importantly, being involved in mentoring others. And I think it's not hard to pick. We would not force a mentor on a mentee. I think it should be a natural phenomenon where actually they see synchrony, so that ultimately the product of shepherding this individual to get to fruition, shepherding the research project, and ultimately publishing it for the satisfaction of the research itself and the fellow also.
Thank you so much for joining us today, Dr. Zoghbi. For more interviews like this, please log on to youtube.com/FITsontheGO.